Very good afternoon to you all. Today I am going to introduce the topic Pathophysiology of Diabetes Mellitus. These are the contents, introduction, types, complications, sign and symptoms, treatment and management of diabetes mellitus. These are the objectives of Pathophysiology of Diabetes Mellitus. So what exact diabetes mellitus? So it's a metabolic disorder, a condition in which glucose level in blood are much higher than normal, and hence this condition is commonly called as sugar disease. So according to one report, it is estimated that about 11.4 Indian populations are suffered from diabetes mellitus, and more than 15.5% of Indian populations are pre-diabetic. So according to this statistics, it is clear that in coming year, more than 27% of Indian population is going to suffer from diabetes mellitus. And as far as overall world data is concerned, 10.4% of world population is suffering from diabetes mellitus, age in between 20 to 70. So this disorder, this metabolic disorder is mainly related to the pancreas. So here the defect in this condition is that either pancreas does not produce enough insulin or it produces sufficient insulin, but the cells or receptor located on cells of the body are unable to use insulin properly. That's why there is not proper entry of glucose. So before going into detail about pathophysiology of diabetes mellitus, in short, I would like to explain you about pancreas. So pancreas, as far as its anatomy is concerned, located across the back of the belly, behind the stomach. So only one organ in our body that is considered as heterocrine gland. So it's both endocrine as well as exocrine gland. The exocrine portion of pancreas that constitutes 95% part, and the basic unit is the acinus, and their main role is in digestion. And endocrine pancreas that constitutes only 5%, and that part is called as islet of Langerhans. So pancreatic islet or islet of Langerhans is a basic functional unit of endocrine portion of pancreas. As far as overall its structure is concerned, it consists of four parts: head, neck, body and tail. So the head portion of pancreas fits into C-shaped curve of duodenum. So after the digestion, food particles coming from stomach that comes into the duodenum. So here exocrine pancreas, acinus, pancreatic juices mixed with the digested food particle. So that's another different function. But as far as endocrine pancreas function is concerned, the functional unit is islet of Langerhans or pancreatic islet, and it consists of four types of cell: alpha, beta, delta and F cell. Alpha cell secrete glucagon, beta cell secrete insulin, D or delta cell secretes somatostatin. Another name of somatostatin is growth hormone inhibiting hormone, and F cell secrete pancreatic polypeptide. So here generally the regulation of pancreas is controlled by negative feedback mechanism from the hypothalamus. So in normal person, what happens whenever glucose level increases? So sensors in blood, they send impulses towards the hypothalamus. Then hypothalamus stimulate beta cells to release insulin. So once glucose level increases, again beta cells releases excess amount of insulin and make the equilibrium. So whenever there is increase in insulin level, again hypothalamus also stimulate alpha cells to secrete glucagon. So in both the cases, somatostatin or growth hormone inhibiting hormone control both alpha and beta. So what you have to remember is, we are concerned with endocrine pancreas that constitutes only 5%, because the disorder itself, metabolic disorder, is related with the endocrine pancreas, and it consists of 4 cell: alpha, beta, delta and F cell. Alpha cell secrete glucagon and beta cell secrete insulin, and there is negative feedback mechanism as far as its regulation is concerned. So there are various types of diabetes mellitus, but most prominent two types are there: type 1 diabetes, type 2 diabetes, and third one that rarely occur, that is gestational diabetes, only occur during pregnancy. And another two types are MODI, that is maturity onset diabetes of young, and neonatal diabetes. But other types of diabetes also there: genetic diabetes, malnutritional related and drug induced. But we have to focus only on two parts: type 1 diabetes and type 2 diabetes. What exact role of insulin then? So it's a metabolic disorder which is mainly related to the endocrine portion of pancreas. And what exact role of insulin? So here insulin is, as far as overall body part is concerned, glucose is the prime requirement. So here brain and muscle cells are totally rely on glucose. So whatever the glucose, and we know very well, if glucose supply to the brain is deprived for 1 minute, loss of consciousness starts. If it is deprived for 2 minutes, brain cells start to die. And if it is interrupted for more than 3 or 4 minutes, there is permanent damage in brain. That's why glucose is essential. So what exactly role of insulin? The role of insulin is to only aid of entry of glucose inside the cell. Once sufficient amount of glucose reaches inside the cell can perform their natural function. So here role of insulin is to only acts as a key which opens the body cell doors. Once it is opens the body cell doors, I mean it's only act on the specific receptors located on cell, and these receptors having affinity, that's why they allow them to bind, and after that it opens the door, and in this way glucose is inside. So its main role is only aid entry of glucose inside the cell, so that once glucose is reached, it performs their own function. So as far as overall diabetes is concerned, what exactly its connection with alpha cell and beta cell in its secretion? Insulin is like, or it acts as a key which opens the body cell doors, and it's allow glucose to enter. Here mainly two types of diabetes mellitus. All cells are in need of glucose, that is sugar, for making energy required for daily life. Just now I told you example, brain cells and muscle cells are totally rely on glucose. That's why they continuous in need of glucose. So as far as type 1, type 2 part is concerned, if you see the first diagram, healthy pancreas, it releases the insulin, and here some receptors are there. So insulin receptors is here. Once insulin act on that receptors, so these having the affinity, after that it opens the doors of cell, and in this way glucose is inside the cell and perform its normal function. And in case of type 1, it is also called as insulin dependent diabetes mellitus, and in case of type 1 there is absolute deficiency of insulin. That's why in the absence of enough insulin, glucose cannot enter inside the cell and remains outside the cell, that is in the bloodstream in high amounts, and this condition is called as hyperglycemia. So here in type 1 diabetes mellitus, there is absolute deficiency of insulin, and generally 5 to 10% of cases are type 1 diabetes. It's genetically inherited. And in case of type 2, two parts are there. Either beta cells of pancreas unable to produce sufficient amount of insulin, or insulin is produced in sufficient amount but the insulin receptor cells fails to respond to the insulin properly. That is the type 2. And generally type 2 diabetes mellitus occurs after the age 40. So I repeat once again, every cell needs glucose for making energy required for its daily life. That's why glucose is important, and the entry of glucose is totally depends on insulin like key. So once insulin act on specific receptors, bind to them, open the door, and there is entry of glucose, then further process is as usual. So here in type 1 there is absolute deficiency or absence of enough insulin. That's why glucose will not enter inside the cell. That is type 1. In 5 to 10% of cases of diabetes mellitus are type 1. And in type 2, two reasons are there. Either beta cell produces sufficient amount of insulin but receptors are unable to receive it. This is one part. Or maybe beta cell releases very less amount of insulin. So these are the two reasons in case of type 2 diabetes mellitus. And third part is gestational diabetes, generally occurs during pregnancy only. So it occurs when the body cannot produce insulin, it needs during pregnancy. That's why in this case it develops high blood sugar level, and this type of gestational diabetes mellitus generally occurs between 24th and 28th week of pregnancy. And if it is not controlled properly, or if it is poorly managed, the gestational diabetes can also raise child's chance of developing diabetes. Now, what exactly goes wrong in diabetes mellitus? So mainly it is related to the Endocrine pancreas, previously we studied that the alpha cells and beta cell secrete glucagon, which is responsible to release the glucose from liver, whatever the spare reserved, and beta cell that release the insulin. So failure of any one component of involving in the process. So first part is insulin. If there is no proper regulation, previously I explained you that the regulation of insulin totally depend upon its secretion. It's a negative feedback mechanism. Whenever glucose level increases, hypothalamus gives signal to the beta cell to release the insulin and it makes the equilibrium. So regulation is the first part. Second part, another failure of any one component, that is secretion. If beta cells are unable to produce sufficient amount of insulin, then there is no entry or there is no opening of cell door. That is the another part. So secretion is the another part, and uptake or breakdown lead to buildup of glucose in the blood. If sufficient amount of insulin is not available, glucose level increases because of accumulation of large amount of glucose, and in this way the blood sugar level increases. And another reason is that beta cell, if beta cells are damaged, there are various reasons of damage of beta cell. Maybe some medicines also responsible for destruction of beta cell. So in case of damage of beta cell, that leads to increased levels of glucose. So in case of damaged beta cell, there is no secretion at all, insulin, and insulin is not available, then there is no entry of glucose inside the cell. So that is the reason what goes wrong in diabetes mellitus, mainly related to its regulation part, its secretion part, uptake or breakdown, and another important part is destruction of beta cell, which is not in condition to secrete the sufficient amount of insulin or absolutely no insulin, that is absolute deficiency of insulin. So this is the action of insulin on the cell. See here, insulin. So here are insulin receptors and glucose, closed glucose transport. Generally the glucose transporters are closed, but once sufficient amount of insulin or insulin comes at the point, it acts on the receptors located on cells. Once they bind, even they are having their own affinity. It's a specific. The insulin specifically bind to the receptor located on cell. Sometimes receptors are also fail to accept them. So that is faulty receptor. But in normal cases, the receptors allows insulin to bind to them. Once it is bind, immediately what happens? The doors of the cells opened, and in this way the glucose reach inside the cell. So open glucose transport only after binding of insulin to the receptor. So this is the normal action of insulin on the cell. So apart from the endocrine portion, apart from the diabetes mellitus, I would like to tell you in short what's another importance of insulin. Its importance role in carbohydrate metabolism, especially transport of spare reserved glucose to muscle and adipose cells. It's also involving in the process of conversion of glucose to glycogen for storage. So whatever the glycogen that is stored in liver can be used in future and muscle, and decrease the breakdown and release of glucose from glycogen by the liver whenever required. It allows them to release in the form of glucose and supply throughout the body part. So here again part comes absorptive state and post absorptive state. So during after, I mean post after 4 hours after the post absorptive state, the post absorptive state start. So here there is continuous release of spare reserved glucose from the liver to the various parts of the body. Second, it's also having action on protein, stimulate protein synthesis and inhibit protein breakdown. In this way it diminishes the gluconeogenesis. And another, its main role in the metabolism of fats, stimulate lipogenesis. So this is the transport of triglyceride to adipose tissue and inhibit lipolysis, prevent excessive production of ketone or ketoacidosis. Now turn to the pathophysiology of diabetes mellitus. So previously we studied that 3 parts are there, but we have to focus mainly on 2 parts, type 1 diabetes and type 2 diabetes. Type 1 diabetes is also called as insulin dependent diabetes mellitus. It means that there is absolute deficiency of insulin. That's why for the rest of life the person required external source of insulin. That's why this is called as insulin dependent diabetes mellitus. So here absolute deficiency of insulin that leads to external or exogenous source of insulin for the rest of life, but it doesn't mean that the person can perform normal activity even though he takes the exogenous insulin. So here low or absent endogenous insulin. That's why for rest of the life the person is dependent on exogenous insulin for the life. Then onset generally occurs before 20-year age. Generally, in most of the cases, it occurs 15 to 17 years of age. That's why onset generally occurs below 20 years. And the number of cases, as far as type 1 diabetes is concerned, 5 to 10% of cases of diabetes are type 1 diabetes, insulin dependent diabetes mellitus, and generally it is the sign and symptoms most commonly 3 polys are related to the both type 1 as well as type 2 of diabetes. So these 3 polys are polyuria, polydipsia and polyphagia. So as far as polyuria part is concerned, excess formation of urine. Polydipsia, it's related to the excess thirst, and polyphagia, it's a meaning of excess eating. So here in case of type 1 diabetes mellitus, if you see here, glucose is available in sufficient amount, but insulin is not available, and in absence of insulin there is no opening of the door and there is no entry of glucose. That's why all the cells deprived of glucose. That's why external supplement of insulin is required only with the aim to entry of glucose inside the cell. So type 1 diabetes, absolute deficiency of insulin, onset generally occurs before the age 20, and only 5 to 10% of cases of diabetes are type 1 diabetes. Here absolute deficiency of insulin, that's why there is no entry of glucose from the door of the cell. So this is type 1. So I would like to tell you what exact these polys. These are the striking features as far as diabetes mellitus part is concerned. Polyuria, generally it's a excess formation of flow of urine. So due to excess fluid intake and glucose induced urination, because the amount of glucose increases in the blood. Weight loss is occurred due to loss of calories in urine. Third part is polydipsia. As excess loss of urine, maybe there are maybe chances of dehydration. That's why excess thirst, and this condition is called as polyphagia, and finally polydipsia, and finally polyphagia or increased hunger due to loss of excess glucose, because body cells are always in need of energy. So here a loss of excess glucose in urine that leads to body, every time the body is in craving for more glucose. That's why these are the 3 important polys generally seen only in diabetes mellitus: polyuria, polydipsia and polyphagia. Type 2 diabetes mellitus, it's also called as non-insulin dependent diabetes mellitus. So here previously we studied that as far as type 1 part is concerned, insulin dependent diabetes mellitus. So here for rest of life external source of insulin is required. But here in case of non-insulin, the term itself is the self-explanatory. Insulin level may be normal, sometimes it's elevated or maybe depressed. So some chances are there, either beta cell produces less amount of insulin or they may produces sufficient amount of insulin, but receptors are not in condition to allows their binding with the receptors. So insulin level may be normal, elevated or depressed, and generally this is characterized by insulin resistance. So insulin resistance part is mainly related. Defective cells are there or defective receptors are there. They are not able, unable to bind the insulin. So diminished tissue sensitivity to insulin, and another part is that maybe destruction of beta cell. So generally beta cell produces insulin. In case of impaired normal function of beta cell, they may delayed or inadequate release of insulin is there, and this type of diabetes mellitus in non-insulin dependent diabetes mellitus generally occurs only after age 40. So risk factors, so it is mainly related to the family history, even sedentary lifestyle, lack of physical exercise, even in case of obesity and aging. But in this part, this type 2 diabetes mellitus, there is no need of exogenous supplement or external supplement of insulin. When disorder is reached into its advanced stage, then and then only there may be a requirement of insulin. But initially, after detection, it can be controlled by proper weight loss, proper diet, and some oral hypoglycemic agent. And when disorder reaches to its advanced condition, in that case only there may be a requirement of insulin. So once again, if you see carefully here, this part, here insulin doors are closed either defective insulin is present. That's why there is no proper binding of receptors and insulin. That's why very less amount of glucose either entering in the cell, or maybe there is no entry of glucose. That's why this is called as type 2 diabetes mellitus. Again, who are prone to diabetes mellitus? There are various factors. It's no doubt it's a metabolic disorder, but apart from that, all other factors are collectively contributed for its occurrence as well as development. So certain medication, these medications specifically act on beta cell and it causes destruction of beta cell. That's why there is very less or no secretion of insulin, raise, even hypertension. So as far as overall diabetes mellitus part is concerned, I would like to tell you that according to one survey, it is clear that, I mean, 2001 to 2020, diabetes mellitus is the number 9 death producing disorder. The first number is ischemic heart diseases, then stroke, then pulmonary diseases, that is COPD, but on 9 number there is diabetes mellitus. But in most of the death that occurred generally in cardiovascular disorder, these are mainly related to diabetes mellitus. That part we have to study later. But who are prone to diabetes mellitus? Certain medications which continuously destruct the beta cells of pancreas. Even pregnancy we studied that. That is for the temporary. So gestational diabetes generally occur in pregnancy. High cholesterol, obesity, family history, and aging is also one part. As the age increases, maybe there is chances of less insulin production from the beta cell, and inactivity, lack of physical exercise. All these are the factors responsible for the occurrence and development of diabetes mellitus. Here it is also hereditary, but it doesn't mean that it immediately passes from one generation to another generation. Maybe in second generation or maybe in third generation it may transfer. No doubt it's a genetic disorder, but I would like to tell you once again, directly not transferred to the second generation, maybe third or fourth generation. So there are various complications, because most of the time we see that glucose is prime importance as far as brain cell and muscle cells are concerned. So some complications occurs which are mainly related to cardiovascular system, a stroke as far as brain part portion is concerned, peripheral vascular diseases are there, renal diseases are there, kidney dysfunction, peripheral neuropathy, and food problems. All these complications generally occurs because of the lack of glucose, and this is because of the deficiency of insulin. So collectively it's a diabetes mellitus. So complications in diabetes are mainly eyes, heart, kidney, and neuropathy. Here one of the prominent example as far as symptom part is concerned, ketoacidosis. What exact is ketoacidosis? This part is mainly responsible for lowering down the pH of the blood. It means that it makes the pH of the blood acidic, and if it is not treated, the result is death. So poorly controlled diabetes can lead to an increased risk of ketoacidosis. Then how ketoacidosis may develop? It is, the example is similar as that of the starving person. If there is no proper amount of kilocalories are ingested, I mean glucose is not supplied in proper amount. So in that case, what happens? See here, the main reason is that there is absolute deficiency of insulin, or insulin is available in very less concentration. That's why in absence of insulin or low level of insulin, there is entry of glucose is blocked. So first part is because of less or no insulin, there is no entry of glucose inside the cell, but cells are always in need of fuel. That's why instead of glucose, the body cells start to utilize fatty acid only for the production of ATP, high energy molecule. I repeat once again, the main ketoacidosis is mainly related to the diabetes mellitus, and it is similar to that of starving person. In absence of insulin or very less insulin, our body cells start to utilize fatty acid for the production of ATP because there is no glucose. So triglycerides in adipose tissues are catabolized, and in this way it yields fatty acids and glycerol. So byproducts of this catabolism is organic acid, and that organic acid is called as ketone body. I repeat once again, here triglycerides in adipose tissue are catabolized, to yield fatty acids and glycerol, and byproduct of this reaction is organic acid, and other name of this organic acid is called as ketone bodies. So here cell continuously uses fatty acids, triglycerides, and catabolize to yield fatty acids, and which leads to the excess amount of organic acid and ketone bodies. So here accumulation and buildup of excess amount of ketone or organic acid causes which continuously convert the alkaline pH to the acidic pH. So accumulation and buildup of ketone causes blood pH to fall, and this condition is called as ketoacidosis. And if it is not treated or if it is not healed quickly, the result is death. So ketoacidosis is the most prominent symptom seen in the diabetes mellitus. So other complications generally seen once there is formation of ketoacidosis: nausea, vomiting, fatigue, weight loss, hunger, increased urination, drowsiness, thirst, abdominal pain. All these common signs, symptoms seen in the diabetes mellitus. So here what you have to remember, there is no entry of glucose, and in that case our body cells start to utilize fatty acids and triglycerides, and whatever the byproduct, that is called as ketone, and accumulation of deposition of large number of ketone bodies leads to the ketoacidosis. This is first part. Second part is most of the cardiovascular disorder. Even though diabetes mellitus is the number 9th death causing disorder, number 1 is ischemic heart disease, but most of the cardiovascular disorder, the main prime reason is the diabetes mellitus. So here there is absolute deficiency of glucose, or very less amount of glucose is supplied throughout the body cell. So in this case, in this starving condition, our body cells start to use triglycerides. So the breakdown of stored triglycerides also causes weight loss. So here lipid is generally transported from storage depot to the various parts of the body. So all this transportation generally passes through the bloodstream. So what happened during this transportation? Large amount of lipids, in the again cholesterol, that deposited on the walls of the blood vessel. So lipid particles are deposited on the walls of blood vessels, and again it leads to another cardiovascular disorders like atherosclerosis, ischemic heart disease, peripheral vascular disease, and gangrene. So considering the death causing diseases, even though number 1 is cardiovascular disease, but initially maybe reason is that diabetes mellitus. So here instead of glucose, our body cells start to utilize lipids. That's why lipid and cholesterol deposited on the wall of blood vessel, and it start to form the plaque. That is atherosclerosis, blockage of heart, blockage of blood vessels, blockage of arteries, and all these simultaneously leads to cardiovascular disorders: atherosclerosis, ischemic heart disease, peripheral vascular disease, and gangrene. So see here, high risk is obesity. Then cardiometabolic risk factors are there, and outcome is cardiovascular event, coronary artery disease, heart failure, arrhythmias, and sudden death. So the one of most prominent reason for the development of cardiovascular disorder is the diabetes mellitus, and this is just because of deposition of lipid and cholesterol inside the blood vessels. Another prominent symptom seen in diabetes mellitus is the blindness. So this is loss of vision due to either cataract. So here in cataracts, what happens? The blood supplies to the retina. Excessive glucose attaches to the lens protein and causing blindness. Initially, it's a cloudiness. And sometimes, because of the deposition of lipid and cholesterol, there is continuously damage to the blood vessels of retina. And in this way, there is initially cloudiness, and after that, blindness occurs. So this is normal eye. If you see carefully, diabetic retinopathy, tiny blood vessels leaks fluid into the retina. That's why initially cloudiness, and such condition is continuous, that leads to the damage to blood vessels of retina and blindness. Then another, the blood that supplies to the kidney, that also blocked because of the deposition of lipid and cholesterol. So severe kidney damage or severe kidney problems generally as a result of damage to the renal blood vessels. So once again, if you see carefully, protein leakage, protein in urine, and all these leads to the kidney and bladder failure. Apart from ketoacidosis, cardiovascular disorder, blindness, and kidney failure. Other complications also related to the diabetes mellitus are gum disease, foot, leg infection, sexual disinfection, and complications in pregnancy. So once again, I would like to explain you in short what exact diabetes below diabetes 1, age below 30, generally 15 to 17, below 20 years of age, excessive urination, that is polyuria, excessive hunger, that is polyphagia, excessive thirst, that is excess thirst, polydipsia. So these are the three polys as far as diabetes part is concerned. And another symptoms: bed wetting in children, unexplained weight loss, dehydration, and sometimes coma. If it is because previously I explained you that if glucose supply to the brain is deprived for 1 minute, loss of consciousness start, and if it is 2 minutes, brain cells start to die, and if it is deprived completely for 3 to 4 minutes, there is permanent damage of brain cell. So here type 2 diabetes, same sign and symptoms are same as far as both the diabetes are concerned. Frequent urination, if excess loss of water. Then another part is polydipsia, always thirst, always hungry, crave for extra liquids because body needs glucose as a nutrient for the production of ATP. That's why always crave for the extra liquid. Sexual dysfunction, unexplained weight loss, complete destruction of body cells, and maybe it is related to the family history. So two parts are there: hyperglycemia and hypoglycemia. Initially I explained you that alpha and beta cell, these are controlled by negative feedback mechanism. So sometimes there may be very less amount of glucose, or sometimes maybe excess amount of glucose. So considering high blood glucose level, the condition is called as hyperglycemia, causes too much food, too little insulin, or illness or stress, all leads to the hyperglycemia. So onset slowly, it's a gradual increase, may progress to diabetes coma. And symptoms: extreme thirst, frequent urination, dry skin, hunger, blurred vision, drowsiness, nausea. And another sign and symptom generally seen in high blood glucose level, hyperglycemia. And in case of hypoglycemia, so here absolute deficiency of insulin, or sorry, glucose. So level of glucose is lower than normal. So this types of condition generally occurs too little food, too much insulin, or diabetes mellitus, or in case of extra exercise. So onset is also sudden, may progress to insulin shock. Symptoms: shaking, fast heart shaking, then fast heartbeat, sweating, anxious, dizziness, hunger, impaired vision, weakness, fatigue, headache. All these are the signs and symptoms seen in hypoglycemia. As far as diagnostic range of diabetes mellitus is concerned, there are two parts: post meal or post lunch and fasting process. Generally this is the method used to diagnose the diabetes mellitus, and that compared to the normal. So in case of normal, it's 80 to 100 mg per dl. If person is suffering from diabetes mellitus, surely if we diagnose, if we check the sugar level, if it is more than 120 mg per dl, so it is surely diabetes mellitus. And 2 hours post lunch. Why 2 hours post lunch is required? Because after ingestion of food, it will remain in the temporary storage area, that is in stomach. So during 2 hours period, there is continuous churning action, mixes gastric juice, and chyme form releases from stomach into the small intestine, that is first part of small intestine, duodenum, where pancreatic juice mix with them. So excess amount of bicarbonate ion that neutralizes the acid. So here what happens, it is compulsory to wait for 2 minutes, and after that if you check, even in case of normal, it's 130 to 160 mg per dl, and if it is more than 180 mg per dl, it indicates that the person is suffering from diabetes mellitus. I repeat once again: fasting blood glucose and 2 hours post lunch. This is the criteria for diagnostic range for the diagnosis of diabetes mellitus. Normal, it's 80 to 100. And post lunch, it's 130 to 160. In both the cases, if it is more than 120 in fasting state, it indicates diabetes mellitus. And 2 hours post lunch, if it is more than 180 mg per dl, then it is indicated diabetes mellitus. There are various risk factors and there are various consequences of untreated diabetes, because in absence of glucose, our body cells utilize fatty acids and triglycerides. We already studied that the byproducts of catabolism of fatty acids and triglycerides is organic acid. That's why some another complications occurs. So 2 times higher risk of brain stroke, maybe deposition of high amount of cholesterol, that we already know that oxygenated blood once comes into the heart, it distributed throughout the body. So it first passes to the coronary artery, into the heart, then from carotid artery it passes towards the brain. If there is no proper amount of insulin, there is no entry of glucose inside the brain cell. Brain cells are continuously in need of glucose. So brain cells start to use the lipids, fatty acids and triglycerides. So deposition of cholesterol from its storage depot and transported through the bloodstream, there may be chances of blockage. And another complications occur as a brain stroke, affects eye and vision. So this is because of the blockage of blood vessels that passes blood towards the retina. Initially cloudiness and then blindness, 3 to 4 times higher risk of heart diseases. That's why one of the most prominent reason behind cardiovascular disorder is the diabetes mellitus. Increased risk of high blood pressure because of again blockage or deposition of cholesterol and lipid in the blood vessels. 17 times higher risk of kidney failure. Specifically, the blood passes to the renal, through the renal artery towards the kidney. If renal artery is blocked because of the deposition of lipid and cholesterol, that may lead to the kidney failure. And it's also one of the cause of loss of sensation in limbs and other nerve damage because of sufficient and not sufficient amount of supply of glucose as well as oxygen. And it's also one of the prominent cause of leg amputation. So as far as diabetes mellitus management is concerned, it can be controlled by proper diet, exercise, medication. We studied that in case of type 1, insulin is required for the rest of life, and oral anti-diabetic agents. So here are some list of oral anti-diabetic agent. Most commonly used is the biguanides. That is, example is metformin and sulfonylurea, glibenclamide, glipizide, glyclazide and glimepiride. These are the drug of choice as far as type 2 diabetes is concerned, and these are called as oral anti-diabetic agents. Some diabetes tips are there. So it doesn't mean that the person who is suffer from diabetes type 1 cannot perform its normal activity compared to normal person. It doesn't mean that. Even though by taking external source of insulin, he or she can perform normal activity. Here are some do's and do nots. And here is insulin requiring diabetes mellitus more serious. All types of diabetes are serious, require full attention. Insulin is given from outside when insulin producing cell do not produce enough insulin or there is absolute deficiency. High blood sugar is toxic to the insulin producing cell and improperly controlled diabetes. Some compliance must be followed by patients. So if it is not properly controlled, diabetes worsen the condition and further damage the already stressed insulin producing cell. That's all the diabetes mellitus.